Thera is a multivitamin product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. It is important to take this medication as directed by your doctor to ensure you are getting the necessary vitamins to support your overall health. The daily dosage and optimal timing for taking Thera will depend on your individual needs and should be discussed with your healthcare provider. When taking Thera, it's important to follow the directions on the product packaging or as directed by your doctor. Usually, Thera is taken by mouth once a day. It's important not to exceed the recommended dosage. Take Thera regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. If you have any questions, don't hesitate to ask your doctor or pharmacist. Many people may experience temporary effects such as constipation, diarrhea, or upset stomach when taking Thera. These effects usually go away as your body gets used to the medication. If they persist or worsen, it's important to notify your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While rare, a serious allergic reaction to Thera may occur. Seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of potential side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If your multivitamin contains iron, it's crucial to keep it away from children as accidental overdose of iron can be fatal for kids under 6 years old. If an overdose does occur, seek medical help immediately or contact a poison control center. Thera is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. It may also be used for conditions not listed in this medication guide. The usual dose for adults is 1 tablet daily, preferably with a meal. It is best to take Thera at the same time each day to help you remember. Before taking Thera, it's important to talk to your doctor or pharmacist about any allergies you may have, especially to soy/peanuts. This product may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Discuss your medical history with your doctor or pharmacist, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal problems like ulcers or colitis. If your multivitamin contains folic acid, be sure to talk to your doctor or pharmacist if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which could lead to serious nerve problems. Always consult your doctor or pharmacist for more details. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to tell your doctor before using this medication. Additionally, if you are breastfeeding, consult your doctor before taking Thera. When taking Thera, it's important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription drugs, over-the-counter medications, and herbal products, and share this with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your doctor or pharmacist about the best timing for taking these medications to avoid any potential interactions. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you are taking certain anti-seizure drugs. It's also important to be aware that Thera may interfere with certain lab tests, potentially causing false results. Make sure to inform the lab personnel and all your doctors that you are taking this medication. If someone has taken too much Thera and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If you or someone you know is experiencing these symptoms after taking Thera, seek medical assistance immediately. Make sure to keep all of your medical appointments and follow up with any lab appointments as directed by your healthcare provider. It's important to note that some brands of Thera may also contain ingredients such as docusate. If you have any questions about the specific ingredients in the brand of Thera you are taking, be sure to ask your doctor or pharmacist for clarification. It's crucial to remember that Thera is not a replacement for a balanced and healthy diet. It's always best to obtain your vitamins from nutritious foods. Be sure to maintain a well-balanced diet and adhere to any dietary guidelines provided by your doctor. When taking Thera, be sure to follow the recommended daily dosage as prescribed by your healthcare provider. It is also important to take Thera at the optimal time for maximum effectiveness, so be sure to ask your doctor or pharmacist for the best timing to take this medication. If you are taking Thera on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and take your next dose at the regular time. Do not double the dose to catch up. Thera is typically taken once daily, with or without food. It is important to take Thera at the same time each day to maintain a consistent level in your body. This can help maximize the benefits of the medication. Always follow your doctor's instructions for the best time to take Thera. It's important to store Thera at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. It's also crucial not to flush this medication down the toilet or pour it into a drain unless specifically instructed. When Thera is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.